Welcome to another episode of Dr. Doctor, the award-winning radio show and podcast featuring your physician hosts, Dr. Tom McGovern
and Dr. Andrew Mullally, where we and our guests discuss relevant and health-related topics from an authentically Catholic perspective. Dr. Doctor is brought to you in part by the generous underwriting of CMF Curo. Learn more at mycatholichealthcare.org. Live your Catholic faith in your healthcare with CMF Curo.
Today, Andrew and I are going to interview a special guest that will be heard across the EWTN Global Catholic Radio Network. We're going to talk about demonic possession and somewhat distinguishing it from mental illness with exorcist and PhD psychologist, Father John Szada. Andrew, why are we covering this in 2022? This isn't a real thing, is it?
Well, the main reason is because we're at this conference and he gave a talk today.
And it was outstanding.
And so I think this was more than coincidence that we were brought together, but the talk definitely spoke to me about something that I think a lot of people, I don't know if they would use the phrase demonic possession, but there are many people who I think who could be plagued with spiritual ailments, things of some nature or another, unconfessed sins, things that play on mental illness like OCD and anxiety. I know in my practice, mental health is such a common complaint of folks that I get to care for. If anything, it's becoming more common. And Father had a great talk identifying how that's related to the influence of the demonic, both in overt possession, but more commonly in obsessions and other things from demons.
Right, things that we might not even realize are portals, which is a word that you're going to hear him use. So, Andrew, I understand you have a story of an experience that enters into the realm of our topic today. Tell us.
Yeah, I saw the title on the talk, the plenary talk today, and I said, ooh, I really am excited for that one. There was a time when I was in college, and basically I went to a Catholic college, and I was walking by the chapel, heard a whole bunch of commotion, went inside, and there was a person, a student, I'm not even sure a student or maybe another person who was more or less having seizure-like activity. It wasn't clear seizure-like activity, but flailing, knocking over things, foaming at the mouth.
Wow.
And shouting.
In the church?
In the chapel, yeah. And the chapel was kind of empty. It was just a kind of a side chapel, so to speak. But it's causing such a ruckus, and we're like, hey, are you okay? You know, try and somewhat go get help and hold him down and this and that, but broke a couple chairs, and it was very weird. And of course, we were talking to the chaplain who ultimately was around and got involved when the patient was taken by EMS to the hospital. We're like, okay, is that just creepy that happened in the chapel? It wasn't a normal seizure. I even, as a college student, could identify that. And the thing that the priest told us very wisely was that, you know, you first look at the things that are common and you try and work through the medical aspects of stuff before you point to a supernatural cause. That being said, it was awfully odd to me, and the priest even admitted, he's like, yeah, it's going to take a while to figure out exactly what's going on, make sure the patient from a health standpoint is not under the influence of drugs and whatnot. But it was shaking for myself and other people involved, and an item of conversation for a long time. And so I'm really intrigued. I've never spoken to a real exorcist that I know of.
That's a good point. I don't know that I have either.
I'm intrigued to kind of get the backstory, and especially as it relates to my work in primary care, when I'm caring for somebody with mental illness, how should I think about this? Are there things that would give me clues that I should be looking at a spiritual aspect or trying to get a priest involved as well?
I can imagine it's scary to us because we're not used to seeing physical manifestations of the supernatural in our lives, are we?
No, it's creepy. And I mean, so much of kind of the popular Halloween and how many horror films, I'm not a horror film person, so I'm not up on that, so to speak, but there's a huge intrigue there. And I know for myself, I'm a cradle Catholic. My strategy has been to just try and avoid a little bit items that could bring out any of that. I'm not interested in that. I know it's real. I don't want it in my life. I've talked to other folks, especially from third world countries, who have had much closer encounters than I have with things of the demonic. So I'm intrigued to see how it fits into our modern life and healthcare for people with mental illness.
Yeah, I wonder if there are ways we're not even aware of that are part of some, maybe not mainstream, but common in certain sectors of society, and they just think it's a game.
Well, and that's the thing, is that so often I think folks are intrigued by this as an item of curiosity. I mean, people talk about tarot cards or the horoscopes, if they still have those in newspapers, an item of curiosity. But as Father said in his talk, it's a portal for an opportunistic demon.
And we don't want to see that. Well, as you know, before we go to the break, we will have our medical trivia question of the day. Today's category is super, human strength. So not more than a human, but this is pretty super as far as the human body goes. So one of the signs of demonic possession is superhuman strength, which is not possible with a normal human body. So the question is an anatomy one. What is the strongest muscle in the human body based on its ability to exert force on an external object? And this force in a normal human being measures 200 pounds per square inch. The Guinness Book of World Record, almost 5 times that, 975 pounds per square inch. You may not know the name of the muscle, but you might know what it does. We'll be back with the answer at the end of the show. But after this break, we're going to have Father John Szada, demonic possession or mental illness, here on Dr. Doctor. And we're back with our special guest today, Father John Szada. We just heard him speak, Andrew and I, here in Denver from where we're recording at the annual conference of the Catholic Medical Association. And he just wowed the plenary session that closed the morning with the topic of demonic possession, or is it mental illness? And that's what we're going to talk about today. So Father Szada, among many other accomplishments, has a BS, MS, and PhD in psychology, as well as being an exorcist for the Diocese of Harrisburg since 2011. Father Szada, welcome to Dr. Doctor.
Thank you. My joy to be here.
This morning, you said something that got my attention. And in fact, we just did it again before we started the interview, and that is, you said there's an incredible importance to the prayer of St. Michael the Archangel. Why is that?
Well, stop and think about this for a second. There are 9 choirs of angels, right?
Yes.
Lucifer was the highest of all of the angelic choirs.
Yes.
The highest of the seraphim, all right? Now, you go down the choirs from the seraphim, you get down to the bottom, you have the angels, which are the archangels. Just above them the bottom are guardian angels, and just above them are the archangels.
Yes.
Stop and think about the battle. It was an archangel from group number 8
yes.
that overcomes Lucifer, the highest, from group number 1.
Yes.
You talk about true humility. I mean, being cast down by somebody who is so below you in the hierarchy. So, St. Michael has some very, very powerful power by God, of course, and the name Michael itself means who is like unto God. So,
yes.
Michael is, our great battle warrior, the chief of God's armies, and helps us in this great spiritual warfare that we're involved in.
And you said that's important when battling demonic influences.
Absolutely.
Yeah. So I guess kind of to start things off, tell us a little bit about your work as an exorcist. In the past, I was under the impression that it was a top secret. Who is the exorcist of a diocese? You didn't want to be known, but that's something we mentioned on air, and you've mentioned it. What changed there?
The demonic has come out into the open. All right, that's what I said in the talk this morning. There's no longer this secret, hidden, occult stuff anymore. It's right there out in the open. And so if people are in trouble, they need to know where to turn, where to get the help that they need. So it's a battle. It's a spiritual warfare all across the board, cosmic warfare. And so we need to come out into the open, not only to teach people about what's going on, but to help them and give them the resources that they need in this tremendous cosmic spiritual battle that's taking place.
And tell us a little bit about what it looks like in the life of an exorcist. You had mentioned kind of an intake process. I think of my clinic. Do you have outpatient appointment slots, or you have to go places on call? What does that look like?
All of the above, actually, yes. Now, okay, there's a couple of things to keep in mind. First of all, actual demonic possession, full possession, is still a relatively rare occurrence. I say relatively because it has become much more common. For example, The priest who had been the exorcist before me for many years, I asked him once, have you ever had an actual case of demonic possession? He said no. In the 11 years that I have been the exorcist, I've had at least 6. Right, those are 6 individuals that are possessed. All right, so but you may have many sessions with a single individual. All right, it may go for years, as I mentioned this morning.
Yes.
So that's part of the problem. So first of all, actual possession is relatively rare, but there are many other levels of demonic influence. All right. The most common, of course, is the influence of temptation. We're all under that, all right? We all receive temptations constantly. But then there can be other sorts of things, such as obsessions or oppressions, all right, where demons will actually attack a person, mentally, physically, sometimes, spiritually. There are demonic attacks that occur, all right? And then you have these infestations, where you have demons will be in a place, okay? A haunted house, for example. Haunted houses is an interesting phenomenon. They could either be lost souls from purgatory, or they could be demons, right? So part of the question is, how do you determine which is which? And there are some ways, all right? There are some ways to do it. For example, demons will engage in all kinds of conversations. If a person sees a spirit, a figure, whatever, you can look at the figure. If it's a full-bodied figure that doesn't really say anything, it's probably a lost soul, right? But if you see a partial figure or a shadow or something like that, and they're talking and saying all kinds of things to you, then that's a demon. Right? So there are different ways in which you can discern these things.
So God doesn't let demons take human form?
That's an interesting question. They can't take the fullness of human form, all right, because they're not human, all right. So that's part of the issue. So what you have to do then is, I just actually had someone stop me a little bit ago and ask me specifically about that question about a house that is supposedly haunted. What should the parish priest do? And I said, the first thing you do is you look at the history. Did anything happen in that house? Was there a suicide, a murder, some kind of trauma that occurred there in the past? Something that happened there. That gives you a clue. Then that might have been a portal that opened it up to the demonic. All right. But the first thing the priest should do is come and bless the house. No question about that. In fact, our houses should be blessed on a regular basis, once a year at least. Usually during the Epiphany
That's a good
season.
take-home point.
Yeah. So the house should be blessed at least once a year.
Yeah, my priest is going to be doing a lot more work if you have to bless houses every year. Holy cow.
That's what we're here
Watch
for.
out, Father Mark.
Yes. So, blessing houses should be a part of our regular routine. But anyway, so, and if you do that, if the priest will come in and bless the house, then, and it doesn't help, all right, then another thing that can be done after that is you'll have a mass said for the deceased soul. All right, and if that doesn't help, all right, and it's still there, and then the next thing would be to actually bring the exorcist in and do what we call a minor exorcism of the house, which is sometimes referred to in the old ritual as the chapter 3. It's the minor exorcism over places. So that can be done. So there are various levels in which these kinds of things occur.
So for our show on health, what is the relationship between spiritual health, mental health, possession? Are there separate buckets? Do the Venn diagrams overlap?
Oh, they completely overlap, and that's exactly the point. And the point that I made this morning was the fact that the human person is a composite whole. We are a person of body, mind, and soul.
Now, isn't the mind part of the soul?
Well, okay, I said body, mind, and spirit is really what I meant to say. I'm sorry. It's body, mind, and spirit. Mind is soul.
So here's my confusion on that, because I've seen it. It's in the Bible. Paul refers to it in 2 of his letters. The thing is, I've been taught that our soul is a spirit.
It is a spirit, but it's not spirit in the technical term. In the writings of St. Teresa of Avila, Teresa of Jesus, she describes a mystical experience in which the Lord showed her that the soul, the spirit, was distinct from the soul. She said she didn't understand it.
Good company.
She only knew it to be true. Okay? So the soul and the spirit, this is the way I like to put it. So the life principle of the body is the soul.
Mm-hmm.
The life principle of the soul is the spirit. So all living things have souls.
Correct.
All right?
Even
But not
plants.
all living things with souls have spirit.
Mm-hmm.
It's the spirit in the human person that allows the soul to be immortal, which is the difference between animals, plants, and human beings.
Yet the soul and spirit have no parts.
Well, in the physical sense, that's correct. Right. So they're all integrated into one in a sense. But the spirit and the soul are somehow distinct, even though they're intimately connected. All right.
Okay.
And then you have the soul, as I said, the soul spirit gives life to the body, which is what the human person is then. So this is where the distinctions come in there. So you can have a person who has genuine spiritual, maledictions, but it's going to certainly have effects on their mental state and on their physical state.
So let's take that one. So how does demonic influence lead to mental illness? And what kind of symptoms might we see?
Oh, no, that's a good question too. But we're taking that backwards. What we have to do is the other way around.
Mm-hmm.
So if we see the situation, a person presents themselves. In fact, during one of the conferences this morning, I had a phone call, a lady who was calling me she was in a mental health institution, and she said, "Father, can you come over to see me?" I said, well, not exactly. I mean, you're in Harrisburg and I'm in Denver, so it's not exactly, but we'll see what happens next week. But so what happens is you get a person who comes in with presenting symptomology. Then you have to investigate the situation, right? So we do either a psychological or psychiatric evaluation. We do a physical examination, all right? And then we have to investigate the person's background, all right? We investigate their situation. So one of the questions I ask is, have you ever received counseling or therapy for anything,
Mm-hmm.
all right? So I have to paint a whole picture. I have to get a whole overview of what exactly is going on. As I said, we have an intake form, which is like 7 pages long, in which you get the whole history of the person, anything that they may have been involved in, anything from their past, any traumas that they may have experienced, any reasons they may think, for example, they may be cursed, which does happen, family, generational things, influence of Masonic influence, all of those things. We look at all of that. Then we have to put the pieces together, and then we say, okay, here's what we see, and what we suspect might be the root cause, and that's what we go after. All right.
So what are examples of root causes?
There can be all kinds of different things, but a person who plays around with Ouija boards, tarot cards, goes to seances or fortune tellers. Those are overt kinds of things. People who read horoscopes, people that use sage in their homes. All of these occult practices, which have become so much a part of, but people have become so. Because this is what I think is really at the root of it, especially with post-COVID, but even before that, there's a tremendous uncertainty. There's a tremendous fear among people today. Without faith, there's no stability. And people are struggling and looking for some kind of, even keel for their lives. And if they don't have God to turn to, they're going to turn someplace else. And that's what they do. So that's why they'll read tarot cards or go to Ouija boards or all those other kinds of things, because they're looking for answers. They're looking for a black and white, something that they can hold on to. All right. And if they're not finding it in the church, if they're not finding it, in God and in their prayer life, their spiritual life, then they're going to go elsewhere. And they do. And they fall into all kinds of things. More and more and more, we encounter situations of people who, for example, have never been baptized. All right. Well, you have no tools to work with.
Right.
There's nothing there. And so, as I said, the important thing is to realize the fact that this entire ministry, we call it exorcism, but it's also deliverance ministry, basically is a conversion process. It's a process of leading people to God, but it's through a healing process. And it's a healing that has to take place on all 3 levels, all right? Physical, mental, and spiritual, all right? You don't take one without the other.
So in other words, when you're working with somebody, maybe for deliverance, something short of exorcism, are they also working with somebody who does counseling or psychiatry?
And oftentimes that happens. I do an awful lot of consultation A person may be seeing a psychiatrist, and I say, okay, when you see your psychiatrist the next time, sign a release form, allow them to consult with me. They'll call me on the phone. We'll discuss the case back and forth. All right. So that happens very frequently. Yes.
Man, and Father, I guess maybe a more foundational thing that's occurred to me through our talk is maybe helping us identify what powers the demons actually have. Because you had mentioned in your talk this morning about, for example, the seal of confession, that what is revealed in confession the demons are not privy to, they can't use. But then at the same time, really everyone finds themselves subject to certain temptations at different times. Can people fall into levels of possession, or is it more like mortal sin where it has to be an act of the will? How should we, I think there's probably listeners who are, am I possessed? Could I fall into this on accident? That type of thing.
Well, the first thing I would say is if a person says, am I possessed? The chances are they're probably not. All right. True possession is the kind of thing where the demon takes over, and to a very large extent, the person becomes unaware of what is happening during the time of possession. They may have these times of blackouts where they don't remember certain special times.
Like in the Chosen TV series with Mary Magdalene.
What can I say? That's just what happens. That's what happens. And it's an interesting thing. You remember the movie The Exorcist, which of course was actually based on a true story.
And is that a pretty true to life except for the head spinning?
Actually, yes, it is. The man who did the movie, I forget his name right now, he actually went to see Father Gabriel Amorth, the famous Roman exorcist, and asked him if he could actually film an actual exorcist, a real exorcism. First of all, he asked Father Gabriel what he thought of the movie. Father Gabriel's reaction was he thought it was pretty good. He said some of the special
William Peter Blatty?
No, he was the one who wrote the book. But anyway, Father Amorth said he thought some of the special effects were a little over the top. But other than that, it was pretty accurate, all right? There was something in there that really caught the essence of the situation. But so those are the kinds of things where an actual exorcism is relatively rare, but there's different levels. For example, this is going to sound a little bit frightening, but it's really true. There can be what we call partial possession, where a person is possessed, but they're aware of what is happening.
And when they're possessed, is their mind, is their spirit, or their body?
This is what I'm talking about. And first of all, it's all three.
Always all three?
Yes, all right. And what happens, let me finish the whole thought here. The first thing is that in a partial possession, they're fully aware, but there can also be manifestations. I think of a person, for example, that I interviewed, and I gave her a blessing when we were finished. I placed my hands on her head, and she began to vibrate and shake and all kinds of stuff just from a blessing, all right? So there's a physical manifestation, and she's aware that it's happening, but she can't control it, all right? So that's partial possession. Then there is full possession, in which a demon will take over a person, and then in a certain sense, the person will black out. And they're not aware of what they have done or what's going on during the time that the demon manifests itself, all right? Interestingly enough, that's connected oftentimes to something that I'm going to be doing some more research on, to the phenomenon known as dissociative identity disorder, okay? We're going to be actually doing some research specifically on that topic.
Because that is not demonic, is that correct? Or is it?
No, in itself it's not. But you see, the point is that DID is oftentimes caused by trauma that the individual suffered many years ago, all right, in which, as a defense mechanism, they've kind of split off aspects of their personality in order to be able to find some kind of normalcy, so to speak. But in fact, when the demons do take possession, it's very similar in terms of its symptomology. So the question is, okay, is it DID or is it possession, right? And there are ways, of course, that the church has of knowing those things. I'll come back to that in a section. The third element is there is a thing called perfect possession. And this is the one that's frightening, that most people don't know an awful lot about. Perfect possession is a situation in which an individual has freely chosen to give themselves totally to Satan. We know cases, for example, and I'm talking about one case right now that I'm involved with, where a priest had already given himself, he was a secret Satanist, Catholic priest who was a secret Satanist, all right, gave himself totally over to Satan, all right. So Satan has possessed the person totally, but the person has chosen that freely. Okay, it's not like they did something. They made a conscious choice to give themselves. That's perfect possession. Those people you wouldn't even know because they don't manifest in the way that other possessions occur. So, and unfortunately, the kinds of people who do that sort of thing are the people we would call positions of power. Yes. They're going to be doctors, lawyers, police officers, judges. Those are the kind of, and those are the ones who are in control in society that are making the decisions that are sending everything to ruin.
So that's a real thing. And
it is, I guess there's so many questions to ask. One more right before our break. Can someone fall into possession without their knowledge? Do I have to worry about this?
Take your break. We'll come back to that.
Oh, very good. We'll be back here on Dr. Doctor with a toughie of a question, I guess, here on Dr. Doctor. And we are back today on Dr. Doctor with Father Szada, who is an exorcist, and explaining to us things that you didn't know about exorcism and demonic possession, but especially as they relate to mental illness. Father, what do you look for? Are there signs that make you think a person is possessed?
What the church has actually given us as far as the investigation into a case. There are 4 signs that the church does. It's right in the ritual that you can look for, all right? So of these 4 signs, one would be the person has a knowledge of languages that they've never known or been exposed to, right? Which I've encountered a few times. A second one is superhuman strength, or physical abilities beyond their normal capabilities. All right, is a second one. A third one is the knowledge of events or things that they should not have any knowledge of, that they should not know, but somehow they're aware of what those particular things are. And then a fourth one is an aversion to sacred objects. All right, and that's a very important one. Sometimes, some priests will play games in a sense. Like they'll sprinkle a person supposedly with holy water, but it's just tap water. And if the person reacts to that...
Oh, I love it.
Okay. If a person reacts to that, then you know that it's fake, okay?
I do the same thing when I'm numbing patients, ask them if they can feel it, and I'm doing this with a needle but not touching them. And if they say they can feel it,
Exactly. Well, let me give you a good one, though. I was interviewing a woman one time. I told her I would meet her in the church. The only time she could come to the church was when I told her she had to be in the church. So I had a number of my team members with me, okay? And I was sitting in the pew. She was in the pew behind me. 2 of my team members were in the pew behind her, 2 women. One of them had just a bag. It wasn't a purse, but just a kind of bag that sometimes women would carry, in which she had a first-class relic. Mm-hmm. And during my discussion with this individual, the woman behind her just kind of gently leaned forward and placed this bag against the back of the pew on which the person was sitting. The woman screamed, jumped up in the air, flew out into the aisle, and said, "What was that? What did you do? What did you just do to me?"
Wow.
She had no idea
of
what was going on, and yet she felt the impact of that first-class relic against her back, even though she didn't even know it was there. So those are some of the things that you can do sometimes in order to test whether or not the person is faking it, imagining it, or if there's actually a demonic presence involved.
If someone is possessed in one of these various levels, what are the treatments that you prescribe or do? Okay,
the first thing, as I said, is we have to find out what was the cause. What was the doorway, the portal that gave the demon entrance? All right, that's very, very important because you have to close that portal, whatever it was. So sometimes the person has to renounce whatever that was that they were involved in. For example, involvement in the Masonic orders. A person has to, there's an actual ritual for renunciation of the Masonic connections. Oh, there's a whole ritual for that. So you find out what the root cause is and you attack that. If it's just a case where a person is just overly possessed the church has her ritual for a formal exorcism, but a formal exorcism has to be given permission by the bishop. So if I have a case that I reach the point where Yes, I'm pretty convinced that there's an actual case of possession. But I write a formal letter to the bishop and ask him to grant me permission for this exorcism, and then he does. Sometimes I have another case right now, for example, where because of the sensitivity of the case, the bishop and I have discussed it, and he's given me verbal permission to do the exorcism, but there's no record of it. All right, to protect it, because there's a lot of things involved in it to protect a lot of things. So that's what we do. So there's a formal rite of exorcism, and there are two forms, of course. Now we have the traditional form of exorcism, the older form, and then we have the new rite of exorcism, which is rather interesting, even in the history of the new rite of exorcism. It was the last ritual of the church to be renewed after Vatican II, just a few years ago, actually. And it was released and almost immediately withdrawn because it became very evident very quickly that it was ineffective, especially from the bishops of Africa. They said, no, it doesn't work. We don't want it, all right? So what they ended up doing was revising the whole ritual and incorporating a lot of the prayers from the old ritual into the new ritual, all right, in English translation, of course. And so now we have these two rites. Father Dennis McManus, I love the man. He's just a great teacher and exorcist himself. But he once said, the difference between the two rites was simply like, in the old rite, you would command the demon, in the name of Jesus Christ, I command you, get out of here. Whereas in the new rite, it's more like, well, if you don't mind, we'd appreciate it if you would leave.
Yeah, probably less effective. I could see that.
So the point would be, depending on the case that you're dealing with, sometimes the newer rite is effective because it's not a real serious case of possession, whereas in other cases, you have to use the older form.
So there are levels of possession.
Yes, there are levels.
And where do the sacraments play a role in this?
Well, again, it depends, because a lot of times the people that are coming to you are not Catholic. So
okay.
that presents a problem, all right? And more, because the ministers of the churches, they don't do that stuff, So then we try to deal them back into their own communities, their own parishes, their own churches. It's very difficult. I've had a number of cases of them recently where I've been to homes of individuals whose homes were being attacked, so to speak, and their ministers came and blessed the place, but it didn't do any good. Wow. And so I went and tried doing different things with them. But there's always that root cause. So in this one particular case, we realized that there was an awful lot of trauma from this woman's background, and there was she was not forgiving those who had done bad things to her, and that was what was allowing the demon to get in there.
That's a pretty small opening.
Yes, and that goes to some of those things that you were mentioning before. Can a person fall into possession or at least demonic attack? And the answer is yes.
What kind of advice then would you have to the listeners who say, well, I want to stay away from that? How do I
grow
protect?
in your spiritual life?
Okay.
Stay close to Christ. Stay close to the sacraments. Pray, be holy. Stay close to the Eucharist, confession. Grow spiritually. Take your spiritual life seriously. That's your best defense against the demons.
So, Father, getting back into some of the nitty-gritty of mental illness, you mentioned off air that anxiety, depression, schizophrenia, dissociative identity disorder, and probably others can be caused or worsened by demonic influence. How do we know as doctors, or how do patients know when that might be the case? Because some of these are incredibly common, schizophrenia not as common, of course, and DID less common.
Well, it's interesting. I just ordered, it should be arriving hopefully by the time I get home from this, the latest edition of the DSM-5 TR, and they finally have admitted that, well, yeah, there is such a thing as possession, although they're still not quite sure where to
DSM.
Yeah, but they're not quite sure where to categorize it.
Can't imagine how many ICD codes fall under
there,
that one.
But so actually, you're right. It's a tricky situation, and we are planning to do some research in that very area. For example, when people claim to be hearing voices, is it schizophrenia? Is it delusional? Or is it really, demonic? So we are planning to do some research in that very area.
You had mentioned earlier that if the patient's undergoing good standard of care treatment and you're not enjoying success, that might be a time to look further.
Correct. But that does not eliminate the need for the mental health treatment. In other words, it's not an either or, all right? So what happens is then you start using prayers of deliverance, prayers of healing, prayers of forgiveness, all right, while at the same time, so that you can be dealing with the root causes, but there are still those residual effects. There's symptoms that are flowing out there. And so that's why the other aspect of the mental health counseling, whatever, is also important. In other words, they go together. It's not one or the other. It's both. And
what would be a good strategy for physicians? You're dealing with folks of all sorts of beliefs and whatnot, to introduce this idea, especially if you're not enjoying treatment success. How can we broach that?
Well, first of all, you have to be able to trust your own instincts. All right. In other words, there has to be a certain sensitivity on the part of the physician, that there may be something more going on here than just a physical illness. The second thing then becomes, don't be afraid to consult, whether it be your parish priest or the diocesan exorcist or even the bishop, about what you're experiencing here. And then I would say you would craft a kind of approach dealing with the specific case that you're dealing with, what you can say and how you can say it, to enable the person to realize that maybe there's more going on here than just their physical symptoms.
So have you been referred clients, patients, by doctors?
Yes.
And what was it that happened with the doctor that led them to send them your way?
Interestingly enough, that was exactly the topic of my doctoral dissertation.
Oh, wow.
Very good.
What the topic was basically, what are the experiences of mental health professionals that would lead them to refer a patient for an exorcism? Right, that was exactly my dissertation topic. So yeah, there are a lot of those kinds of, again, it's like a detective work. You have to be sensitive, you have to be discerning, you have to be open to what's going on in front of you, but you also have to be aware of the fact that you, if you're taking that seriously, could yourself come under attack. And if that happens, that's a pretty good sign that there really is something demonic going on there.
So what kind of attack would the doctors experience?
It could be all kinds of things, anxiety, fear, tension, thoughts that go through your minds. A couple of people have stopped me today and said, yeah, I suddenly had this thought out of nowhere that, how could you possibly believe in the Immaculate Conception? He said, and that went on for a whole day. And he said, where was this coming from? That's the kind of thing that happens sometimes, things that just come out of the blue or seemingly out of the blue, but are actually demonic responses to something maybe that you're trying to do yourself, either for your patient.
Well, and I guess a thought that occurs to me is that, I'd almost rather not talk about some of this stuff. You had mentioned the movie The Exorcist, and there's books on exorcism and whatnot. I mean, there's an intrigue there, but is it more prudent to just totally stay away and not think about it unless we subject ourselves to attack?
In other words, focus on being possessed by the Holy Spirit.
Well,
there you go.
But the other thing is, and you're also denying a certain element of reality.
Sure.
Which we can't do anymore because the demonic, as I said, is out in the open. It's all around us. It's influencing church, state, everything all the way down the line. So we have to be.
What advice would you have to people who have an interest there? Is it okay to proceed with trying to learn about some of that? Are there good resources that we could recommend?
Never do it on your own. Always do it under the guidance of a priest or an exorcist or somebody who can kind of, keep an eye on that. In other words, it helps to have a spiritual director. Okay, have a spiritual director that you can sit down with on a regular basis, talk to, get guidance from, and let him, or her, women's spiritual directors, guide you in where you're going with some of those things. Because sometimes a person's going to say, no, I think you're going a little bit too far on this. I actually just did that last week with somebody. But in other cases say, yeah, maybe you should look into this a little bit more. So don't ever try to do it on your own. Have some guidance and direction in it. Yeah.
That's really good. One other question, kind of unrelated, but during your talk today, you mentioned something called speak boxes.
Oh, yes,
which
thank you.
I had never heard of. I'm thinking of folks who are listeners who might have children. Tell us about that and other things that we should think about.
Well, I don't know if you noticed, but we had 600 people in there.
Yes.
And I asked how many had heard of speak boxes, and I didn't see one hand go up.
Even the medical students.
Me neither. Yeah.
I've never heard of them. All right. Speak boxes are devices that are apparently something like a cell phone, but you don't call a number or anything like that. It's not like it's some kind of a gimmick. But it's supposedly wired in such a way in certain frequencies. And demons love electronics, by the way. They play all kinds of games with electronics. But anyway, it was supposedly enables a person to speak with the dead. All right. So sometimes people get depressed, discouraged. Where's my husband? Where's my son? Where's my, whatever? Are they okay? Are they at peace? Blah, blah, blah. And so they get one of these devices and they contact the dead and have a conversation with them and don't even realize the fact that they were actually talking to a demon, because God does not allow the souls of the deceased to engage in conversations with the living.
Wow.
So, those are portals. And I've had 3 cases now of individuals who have used speak boxes, and in every single case, they experienced attack afterwards.
So, Father, to me, from the outside, it seems like, those who practice, Wiccan religion and their special prayers and formulas, it seems like almost the prayers of, releasing somebody from possession almost sound like some magic formula. How are they not?
Because they're backed by faith.
But you said that one new rite wasn't effective, but that was still backed by faith. So what's the difference there?
The language itself, well, first of all, it's the language of the church. Mm-hmm. Because if you're not careful, you could almost say that the Eucharist is magic.
Right. But it's not.
But it's not, all right? So these are the sacramentals of the church, and these are sacramentals, not sacraments, backed by faith, but they are the official rites of the church. Mm-hmm. And so as a result of which they have a totally different status. They're not just simply magic formulas, all right? The very language itself, and Father McManus talked about the fact that the language of the old Rite of Exorcism is a very specific form of Latin, which is a very ancient form that was found in no other of the church's rituals. It's a very strong, powerful ritual formula attacking the demon in a very strong way, much of which has been lost in translation, right? Even though you have the words, you don't have quite the oomph behind it, so to speak. It's not magic. It's backed by the faith of the church, but it's backed by the authority of the church, and that has a lot to do with it.
But what was it about that new rite that it didn't work, and then they went back to the old prayers?
Well, because without actually going through the rite itself, it would be kind of hard to give you a real in-depth answer on that.
But there were substantive changes.
There were substantial changes, yes.
Okay. And I guess as we're kind of wrapping up here, this opens a lot of different questions, I think, for people. What would be a resource we could point them to if they wanted to learn more, if they have more questions relating to this, especially as it relates to mental illness, because so many people suffer from mental illness?
Well, since this is a podcast which is primarily geared towards medical professionals.
And lay people.
Lay people? All right.
Yeah.
One of the things, again, I would suggest is this book which we've just come out with the second edition to, the Guidelines for Mental Health Professionals Supporting Persons Seeking Freedom and Recovery from Possession and Other Spiritual Afflictions, which is published by the Catholic Psychotherapy Association, which you can get if you go online to the Catholic Psychotherapy Association website.
Which is catholicpsychotherapy.org.
Correct. All right. So you go on there and you'll be able to find this. But that's a place to start. But again, I would suggest that you have to be very, very careful. Always do it under the guidance of a priest or an exorcist, somebody who can, recommend or suggest things based on your own particular background.
Because there are so few spiritual directors now. How do we overcome that?
Well, for example, in my diocese, they have actually run a program which is trains lay people to be spiritual directors.
Beautiful.
Okay, and one of the individuals who is one of those is one of my directees. So I directed him all through the program, and he still comes to me for spiritual direction, even though he has 3 or 4 clients of his own for spiritual direction. So I think that's what we need to do. And we also need to get more of our priests, willing to take that on, because that's our job, that's our role, that's what a priest is about, So I think that's a possibility.
Oh, someone in the hall wanted me to ask the question: how do we let the young people know the things that are really dangerous that they think are just games, and how do we let parents know what to look out for?
This is the responsibility of their parish priests. He should be saying these things in youth group meetings. He should be saying these things from the pulpit. He should be saying them at every opportunity that presents itself to him. Don't just, brush it aside or ignore it. That these are the things that should be. I am very, very happy. I get requests to speak at all different places. Not too long ago I was asked to come to one of the college campuses near where I am. Spoke to the young people there. It's parishes, 40 hours, wherever I have the opportunity to go, as I am here today, speaking here to the Catholic Medical Association. So these things are important, and I think that people can pick up from what I say and carry it on from there.
So is there something more than speak boxes, Ouija boards, tarot cards, seances, horoscopes?
It's a whole attitude. I recently had to go to we have a community of hermits, Carmelite hermits in my diocese, and some group unknown came and apparently did some ritual curse in the property right after the Roe v. Wade decision, by the way. And they could all feel that they were under attack, and it was rather sad. I had to go and do a minor exorcism of the place, prayers of protection, and prayers to break curses, because curses are very real too. So yeah, it's a very involved sort of thing, and people don't even realize sometimes. So people can be under attack because they've been cursed by somebody else.
It can come from the outside.
Come from the outside, yes. Mm-hmm.
So what's your last word of hope for us?
Pray. That's the key. Pray and depend upon the grace of God, because that's what we need.
Father John Szada, thank you so much for being with us on Dr. Doctor.
My joy. Thank you. God bless you.
And we are back with Dr. Doctor and the answer to the medical trivia question with the category Superhuman Strength.
As you heard, Father Szada said that's one of the 4 signs that pretty convincingly can point to demonic possession. So my question is, it's not superhuman strength, but it's pretty strong. Which muscle in the human body, based on its ability to exert force on an external object, can do 200 pounds per square inch, while the Guinness Book of World Records is 975 pounds per square inch? Which muscle is it that can do that incredible amount of pressure? Did you know this, Andrew?
I had heard of this before, but I didn't remember it.
Yeah, the muscle is the Masseter muscle. And while the name might not be familiar, its function is. It's the one that allows you to bite your teeth together really tightly.
Yes, and I think the dental listeners will recognize that's the cause of all these fractures of the old fillings and everything else, because it's such a strong muscle.
Well, and it also leads to TMJ syndrome, temporomandibular joint problems, and that grinding. So people who are grinding, that's your Masseter muscle that's overactive. And while that's not superhuman strength, that's really a high amount of strength. And they've estimated, crazy people, that the megalodon and T-Rex probably have had the highest bite strengths of any creatures known, if Megalodon exists. I don't know. Those of you who watch Shark Week, of course it exists.
Well, see, now you've got me intrigued about the Guinness World Record, how they tested that, and what that study was like to accomplish
There is
that.
a measuring device, and it had a bizarre long name that I actually did not commit to memory. That will shock my wife and those who know me.
How do you train for that test,
Yeah, how do you don't. So, enough on the Masseter. Andrew, there was so much in that interview. I mean, it's just a blast talking to Father Szada. What are your top 3 takeaways?
Yeah, there's a lot of things. I guess my number one, he said a couple times that I really liked, is don't do it alone. I know this whole topic of demonic possession and spiritual warfare is an item of intrigue for many people. And he had really good advice. Get yourself a spiritual director, speak to your priest, have someone help guide you so that you also don't fall prey to items of the occult or of too much intrigue for intrigue's sake, So I thought that was great advice.
And I love the way that exorcists just talk matter-of-factly that this is a part of reality just as much as Dunkin' Donuts down the street is a part of our reality. Actually, more a part than Dunkin' Donuts.
It's really incredible, because I do think a lot of folks, myself included, would rather not confront this on a routine basis, but then it leaves you ill-prepared, I think, when it does come into people's lives. So
yes, it's real. So, number 2.
Number 2 was his antidote for the faithful to protect themselves were primarily the sacraments. He said in his talk today, I know that confession was the number one thing, and he said not to minimize the rosary and St. Michael and all these other things, but if you're going to confession, that restores your union with God and forgives your sins, and those things that you discussed there are not something that the demons can actually prey on or use uniquely to make your life more challenging. So avail yourself to the sacraments. And then number 3, I would say for practitioners and doctors and providers of all sorts, refer when appropriate. I know, Tom, you've probably had cases like this, but I can think of cases when everything's, for once, going right, you're doing everything, and yet you're not met with the results that you think you should be met with. And so be open to the idea that there's a spiritual element, and don't hesitate to refer to your local priest.
And I love the point he mentioned in his talk this morning of our recording day and during our recording, that we can trust our instinct that something might be off.
Yeah. And how many times have people told you that, or you've experienced that yourself, where you can't put your finger on it, but there's something awry here? I
experienced that, and it's not, of course, in what I treat. I treat skin cancer all day long, operating on it. But I can sense with the patient there's something in the room when I'm in there that's just not right. I just can't wait to get out of there, even though nothing is specifically said.
Yeah, that is scary. And I would say if you are unnerved by any of this, go to confession and go to Mass.
Amen. Hey, thanks for being with us for another episode of Dr. Doctor. You can find this episode and all our old episodes on our website, drdoctor.org. Just click on Episode Archive at the top, and you can search over 280 episodes by topic or guest.
And all of our episodes, except this one, are on video format on YouTube. We're doing a away episode, so to speak. So this one is just audio. But generally, check out our videos on drdoctor.org. And if you've got a great idea for an episode, submit a question. Click on that button and tell us what you think.
This is Dr. Tom McGovern.
And Dr. Andrew Mullally, and we're signing off until your next dose of Dr. Doctor.
The views expressed on Dr. Doctor do not necessarily represent those of your co-host. Have a question for our doctors or a topic you'd like to hear about? Call or text your questions to the Holy Cross College text line at 260-436-9598 or fill out the form at drdoctor.org. Follow us on Facebook and Instagram at Dr. Doctor Show and tune in for new episodes every Friday. Plus, find all our past episodes at drdoctor.org.
This show is a production of the Spoke Street Media Podcast Network.